I'm here at the BEST conference with Irene Sclare. So you actually created the Discover workshops. I'd love to know how you got into that.
I was working in an adolescent mental health team and working with older teenagers, and two reasons. One, there would be young people who didn't quite manage to get to appointments because they had exams, or young people who just had a long history of being patients for a long time, not being seen early enough. And I was also working at one point with unaccompanied minors and who were asylum seekers. Their primary needs were more practical. And I began to think that possibly clinical site, where there were 12 to 18s, wasn't as accessible or appealing, acceptable for the older teenager who had lots of other stuff going on in their lives, whether it was, the worst case fears of refugees, or whether it was the very exam preoccupied young person, or the person who felt hopeless and had been seeing people for a long time. And one of the young people said to me, if only I knew that I wasn't the only person in the world who felt like that. So that was very powerful for me.
There's a difference between one-to-one and group work as well.
Definitely. And I think for that young person, or for any of them, there was some way in which they would have found inspiration from others, not just the kind of clinical supposed expert. And also when you're working in a clinic situation, you're guiding people to kind of choose something, but in a way you're shaping what they want to do. So I really was interested in thinking about it, turning it out, moving outdoors, being in the community, but also thinking about what they thought was useful, maybe offering more choice rather than more kind of tightly guided, and being a bit more relevant to the very big challenges for over 16s in the world.
You've chosen that the teens would actually go through self-referral rather than either kind of a compulsory approach or that more targeted approach that could potentially leave them feeling isolated. Tell me a bit about that self-referral process.
We would pitch very honestly and openly to young people in school to say, this is what we've got. It's been proven to be effective with lots of young people, and stress is a big problem, and it can lead to anxiety and low mood and can really get in the way. And we think we've got something we can offer, but why not give it a chance? So opening it up, it's not just saying whoever comes, but publicizing it in a very active way to everybody so that people could then make a choice and come forward without having any other barriers to accessing help, because there are many different gatekeeping, as you might call it, getting referred by somebody. So it doesn't need any other help-seeking pathways, but also hopefully you can get young people either who didn't know help was available or didn't realize that some of what they were going through could be treated. But I think, as I said in the talk earlier, to me, really importantly, although child mental health services work very hard to try to be engaging communities in terms of referrals, there are definitely fewer young people from minoritized communities, fewer young people who've got complex lives. And if their parent needs to be present too, there are very many conversations which are much harder for young people to have. So something that could appeal to over 16s that was easy to access, to step in easily, but also something that was trusted. And I really like that, because I don't think it helps young people to be patients who are attending a clinic. And when you're in a clinic, there's so many ways in which you can't operate that it's limiting the clinician as well.
No, definitely. I think that process really works in terms of them having that kind of autonomous choice to go as well. I think it's so important. But sometimes it can be potentially a bit exclusionary, especially when we're thinking about the idea of young boys and the stigma around mental health and not even coming forward. So how do you think we can kind of overcome that challenge when it comes to helping young boys to come forward for these types of workshops?
I think there are all sorts of young people who wouldn't come because being in a group is too frightening, either because they've been bullied or because they're so fearful and socially anxious. And we have had some young people who would say, I only can cope with one-to-one. I can't cope with being in a group. And maybe some young men would find it hard to be somewhere where they had to be visibly vulnerable, but at least open about difficulties. We find that individually, that's not so much of a difficulty for some young men as others. Maybe being in a group could seem like more exposing than it actually is. I think there's probably some idea among some young men that they should look cool and coping in front of other people, particularly girls. So in mixed schools, mixed gender schools, we have more girls coming forward easily and fewer boys. But we do work with all male schools. And I think young men, if they've got a empowering male head teacher, that's where someone say, come on, I know you're stressed, get in there. Or I get stressed and, I find these techniques helpful. So I think you will too. So maybe some more directedness, whereas maybe young women come forward more naturally. But schools are quite biased toward the more senior women than senior men in the teaching profession, I think. So I think there's something about the context. And in mental health psychology, there are more women psychologists than men psychologists. So that may be another factor. So we work quite hard to try to bring in examples that of anybody we're talking about where there are young men involved, but not in too vulnerable a position. So one maybe has to be a bit open. So the film you just saw with Jay is really important to us, that he's using the words of a young man who was in a fairly empowered school, talking about how difficult it was to recognize what he was going through. So I think there's a societal element, isn't there, too, that's hard to know how to work with.
Definitely. I think you were also talking about role models, which I find really interesting. My brother's assistant psychologist. He's trying to get onto a doctorate, and he's on specific programs for specifically Black young men who are kind of not represented within the psychology space. And I was actually thinking, in terms of the mental health support teams, in terms of representation, how are you going about that? How are you making sure that the facilitators of the workshop are representing the young people that they're helping?
Yeah, I think that's a really big point, because I'm speaking as someone who delivers Discover programs and where I then trained MHSTs in the study, and I would say they were predominantly female workforce. So that is going to be an issue for them, definitely. And I don't know what because I'm independent of them, I don't know what the MHST services are doing to draw in people who represent all genders and all ethnicities, etc. So there's a lot of work to be done in every organisation, isn't there? But maybe young men coming forward and speaking openly about, not just about having difficulties, which is part of it, but talking about the helping process and what's been helpful to them, I think is really important.